The upper back mobility test is going to look at your ability to rotate your upper back as you're on the floor. So we're going to get down into a sideline position. You're going to be kind of fetal position, right leg up in front, bent, back leg or bottom leg is going to be straight. Arms are stretched out, and our goal here is to rotate this upper body as much as you can, trying to get the shoulder and that hand to the floor. So our goal is to try and open up. If you can't touch either, that means we haven't passed the test. So our goal is to try and get that shoulder and the hand. So don't just reach back here and touch and say you passed the test. That's not the case. So the goal is to try and keep the knee down as well. So as you open up, if the knee is coming off to get there, we failed the test. If we're opening up and you're just touching with your hand, we haven't passed the test. If you were unable to pass the upward mobility test, here are a few exercises that can help improve that so you can pass the next time you test yourself. We're gonna do the open book. Same thing, you're gonna put yourself in that same position as the test, except you're gonna do multiple repetitions. So you'll be in that same arms outstretched, knees bent, bottom leg straight, opening up, rotate out, and then back. Rotating out, and then back. You can shoot for 10 reps and make sure you're doing both sides. And you can do multiple sets on both sides. Another exercise that you can utilize to improve range of motion or mobility at the thoracic spine during the rotation test is a foam roller. Most of us have these, but we don't use them. But this is a great way to help open up some of that space in the thoracic spine to help you rotate. So hands behind the head, you're gonna bridge up, and you're just going to roll back and forth in that mid-back region. You can add a little bit of curvature here as you round out the neck, or you can even open up a little bit more as you roll back and forth. You can get onto one side a little bit more, so bias the left side, or you can rotate to the other side and bias more of the right side. Spend about 30 seconds to a minute on each side, or you can go straight down the middle. Try different variations so you can hit different parts of the mid-back. Another exercise to help improve the upper mobility test is thread the needle. You're gonna drop down to your hands and knees. You're gonna take one hand and you're gonna swoop through, threading that needle there. You're gonna try and reach as far as you can. Try and rotate your trunk. You're not just using your arm, just reaching back and forth. You're going to try and rotate similar to the test and back up. Rotate and reach and back up. And then you repeat the same thing on the other side, shooting for 10 reps. Rotate and reach, looking at both sides. The upper mobility test is important, especially when it comes to basketball. Being able to twist and turn, especially if you're in the air and you're grabbing a rebound, ripping a ball from a defender. Different types of motions require you to turn and twist. So make sure you're utilizing these exercises to help improve your range of motion and mobility so you can perform better on the court.